Good afternoon, everybody. Thank you for tuning in before the weekend. Big weekend, our country's birthday. We want to celebrate, but we need to do it safely. We'll talk about that. Go over some information here. No deaths over the last 24 hours. A little bit of good news going into the weekend. Again, a reminder, we've lost 188 of our neighbors in this process since March 16th. And certainly, please, let's keep in mind when we're dealing with this virus and we're learning how to live with this virus that to date, 5% of folks that essentially have come down with the virus, and again, we want that percentage to get lower, have not recovered. And so that is a sobering reality that everyone needs to understand, and we need to continue to respect this virus and how powerful and how clever it is. When we look at testing, we received 1,913 tests back yesterday. Good infection rate. Universal testing, as a reminder, the Syracuse Community Health Center, 9 to 5 on weekdays. Tomorrow is technically a holiday for most folks, so the Syracuse Community Health Center will not be open tomorrow or 4th of July. But in partnership with Upstate Medical, we will have a mobile testing unit set up tomorrow at the On-Center parking lot on the corner of East Adams and State Street, right outside the building where we are right now, from 9 to 1. Tomorrow, 9 to 1. We're going to talk about why in a minute. If you want to get tested, please call 315-464-2582. Option 0 to register in advance. Certainly, over the weekend, if you come down with symptoms, you're sick, please call your doctor. You can get testing at your doctor's office, and there's other urgent care sites that you can get testing. The key being, if you're sick, you need to get a test, period. Again, reminder, our mandate is 775 tests per day. And certainly we had, yesterday we reported 2,504 tests for our region. So far exceeding that, which is good. As we get back together again in these phases, we always knew there will be more risk for COVID, even if COVID's weakening a little bit. When you bring more people back together again, risk gets much higher. And so how do we continue to fight and learn how to live with the virus? We test, we test, we test. And then we trace and we quarantine and we isolate when we have positive cases. So that's good. Hospitalizations, 31, same as yesterday. We have 4 people who are awaiting return to their home, nursing home. The governor's executive order, you need to test negative once you are in a hospital if you came from a nursing home to return to your residence. We have 4 individuals that are still waiting that, so essentially our hospitalization rate has been stabilized for a period of time, looking somewhere between 25 to 30 in the hospital for a period of time. So that's good news. This is not straining our infrastructure whatsoever, and a sign of kind of where we are with this virus. When we look at ICU, 5 individuals in the ICU. I ask that everybody thinks about them and prays for them and their families. The ICU is a tough place to be with COVID-19. So please think about our neighbors in the ICU. To date, we've had 510 people who have been released from our hospitals. That is good. We want people to come in, but we want them to go home. Get the proper medical procedure you need when you're sick, but get home as well. Gap in the investigation. And we have opened up the on-center parking lot tomorrow with intention and expectation that folks will go and get tested. We now have several cases confirmed of individuals that attended the Rye Day party that was held on the near West End about 11 days ago. This event was held on June 20th. The individuals were there from 4 p.m. to 7 p.m. Our request to the community is if you are at the Ride Day event, that you go tomorrow to the on-center lot from 9 to 1 and you get tested. If you cannot make those times, our request is that you go to your doctor and you get tested. The individuals developed symptoms 2 days after being at the party. So, again, with this virus, as you learn more, they could have been a carrier, they infectious at the party, and we know that we've had 2 people there. And let's just do some math here for the community at large to understand. We know our infection rate is somewhere between 0.75 and 1.5 from our testing. So if you have a group of 1,000 people, just by the numbers, you know that essentially 1.5 folks in that setting will most likely be positive with COVID-19. So that's why when you look at the gathering numbers, what you're looking at is you're looking at numbers and you're balancing it with risk. So we're supposed to have gatherings of 50 where we're allowed to interact together. Certainly there is a likelihood based off of numbers if you have 50 people there, nobody there will have COVID. So what do we do in addition to that to protect ourselves? We wear a mask if we're going to be within 6 feet of each other. Even if we're 50 people together, we want to physically distance so that we eliminate any further risk. When you have hundreds and hundreds of people together, you're breaking the law, and there's risk with that. And now from this event, we've seen multiple bad outcomes. So I want to thank our Department of Transportation specifically. I've asked them to come into work on a holiday now to man the site with Upstate Medical. And I want to thank our DOT employees taking time out of a holiday day for them so that we can try to get our arms around COVID-19. They've worked very hard with us. Looking at overall numbers, 2,765 positive cases. That's up 26 from yesterday. Infection rate, about 1.2 overall. When you look at our infection rate related to community spread, it's cut in half there, so about 0.6. 7 household contacts, previously confirmed cases. One of our cases related to a senior facility. That's very good news. Direct correlation with these folks and hospitalization numbers. 2 cases related to travel. 1 case related to a congregate setting. What does that mean? Essentially, think of a group home. So out of the 26, we have 11 contacts. 3 are unknown, still being contact traced. 12 community spread. So the numbers up a little bit from where we've been related to community spread. Overall, the cases are, but the infection rate's about the same from where we've been. And 7-day average community spread, 6.4. That's a good number. We need to keep that number there. And just to remind people, when we get a cluster, first off, if you're sick with symptoms, you stay home. You don't go to work. We talked about this in the beginning of this process. Now we need to reiterate it because we've seen examples where folks haven't done that. If you're sick at work, there's a likelihood that you'll get employees sick with this virus, and then they can get other employees sick. By the time you're tested, you may have gotten others sick, and then we get everybody quarantined, and then even once people are quarantined, we'll still get positive cases because of household contacts. And that's how that cluster could work. So it's critical to avoid these clusters, and certainly how do we do that? If we come down with any symptoms of COVID, we stay home and we go and get a test, and then we're quarantined until we get the test result back. So those are the rules. By us following the rules diligently, we've gotten to this point. And where are we? If you look at it, flat positive cases, we flattened our curve. Recoveries, flattened going up. Active cases were flattened, now they're going down. These are the trends we need to continue to go on. If we are smart, these are the trends we'll see. If we make mistakes or unforced errors in this process, we jeopardize this progress. So looking at recoveries, 68 new recoveries since yesterday. Cases down to 403. That's down 42 since yesterday. When we look at the cases and where they are, who they impacted, 1,626 of our cases have been female, 1,137 have been male, 161 under 19 years of age, 492 in their 20s, 368 in their 30s, 336 in their 40s, 427 in their 50s, 343 in their 60s, 263 in their 70s, 231 in their 80s, and 144 in their 90s. Even though cases have gone down, when you look at what trends, certainly some trends with as we're very happy that our demographics that are most vulnerable to COVID, those numbers have gone down. Certainly trends with those demographics that are more social in behavior are seeing, the percentage of our new cases are certainly related to those. So that's not something that is unique to Syracuse or Central New York or Onondaga County. We're seeing that across the country. That's why people need to be smart and be safe, especially when you're in social settings that you're just, not, quite frankly, haven't been around those people during this process. A reminder on a quarantine, and again, this is why we need to be safe. The worst place to be outside of being very sick with this virus is a quarantine. You're in a quarantine for 14 days. There's no exceptions. And then in day 12 or day 13, if you get symptoms, you're then out longer because you're now being treated with COVID. So again, that's why we don't want to be in these large gatherings. We don't want to be involved in these large settings. And when you're in a position where we're contact tracing, and we haven't had this problem yet, but my colleagues across the state have. And if we get this problem, we're going to act, and we're going to act strongly. Is when we're contact tracing and telling you you need to be in a quarantine, this is not a compromise. There's no diplomacy here. You're in a quarantine. It's an order. And if you break a quarantine, you will have legal ramifications. So this is a real problem now. So the best way to avoid being in a quarantine is to be smart and be very cognizant of what you're doing in your social lives. Obviously, there's some things that will happen and you're in a quarantine and there's nothing you could have done to prevent it. But certainly going to a large party on the 4th of July weekend to celebrate the country's birthday is not a good idea. Have your barbecue, enjoy yourselves, do it in a safe way, and large gatherings are not allowed. And we've asked our local law enforcement partners to really focus in on physical distancing and social distancing complaints with large gatherings because there is risk in many, many ways. Saying that, we'll take questions. Yes.
Ryan, real quick, how many people tested positive from the Rye Day party, and how difficult is it to?
We've had several. We wouldn't call it an outbreak. It's a handful right now. We're still contact tracing there, and certainly we believe that we're setting up a mobile testing site essentially to ask these folks to get testing because we believe the risk is there for more people to have been exposed. And so that's why we're asking the public now. Our release is going out, probably has already gone out, but we're asking folks who were there or who have had contact with people who were there, if one of your relatives or siblings went there, to go get tested. And that's why we're doing it on essentially what is a holiday for county employees.
And is there any more difficulties than there'd normally be in trying to trace who these people may have been in contact with, other than knowing that there was a large party?
Yeah, the difficulties is we don't know how many people were there. And when it's a business, it's very easy to contact trace with employees and then work with them, customers with businesses, depending on what the business is. Many of the businesses, thankfully, that have had cases don't interface with the public. Some that have interface by appointment only, or there's a transaction log history with those businesses. This is a case of essentially a mass gathering. So we don't know who's there. We are basically talking to these individuals who have tested positive. Who did you have contact with there? And they're telling us, and they're being cooperative. But then we have to go try to get in contact with them, put them in quarantines, and then others, we don't know others. Now this situation developed where you have a party, 2 days later, the folks became symptomatic. They eventually go and get a test. We get the test results back. For many of these people who went there, we're now in a position of 11, 12 days. So symptoms should have started to pop up with some of these, but not all. So we want folks to go and get tested.
It's been almost 2 weeks since that party. Are you concerned about the spread that may have happened in that time?
Well, we start seeing it now, and that's a concern. That's why we'd like to get everybody tested. And if certainly, if you're a relative of somebody that was there, or somebody that just interacting with somebody who went to the party, since then, go get a test. We know people have tested positive who were there.
Have any of the law enforcement officers that were there tested positive?
I'm not going to get into specifics on who the people were related to that, but certainly law enforcement officers and our emergency responders always get preferential treatment to get quick turn times on testing so they can get in quickly and get the turn times quickly so they can get back to work if they're negative. Other questions?
Ryan, you've identified a number of cases now in the last few days that were attributed to travel, which is something we really haven't seen much of in the last couple months. Where are these people coming from?
Yeah, I don't know the specifics, Tim, on where they're coming from, if they're coming back into the community. We probably anticipate, certainly when college kids come back too, we'll have, for example, if you have, when SU comes back, we're going to be doing a lot of testing of those students. They would be attributed, if you think of just the infection rate rules, right, whether symptomatic or asymptomatic, when these students come back, there will be positive cases. There's no question. They would fall under the travel category in our reporting. I don't know if these are folks coming back in from vacation from other spots or whatnot, but I think to your point, it's something we're going to start watching more closely. We haven't had to really deal with this since the beginning part of the process, where we had New York City travel, we had Denver travel, where we had specifics. But certainly as people come into the community from vacation, travel, or certainly as we welcome back in students and with new testing protocols, we'll get cases that will fall into this category.
Are some of these recently that you've seen students?
I don't know the answer to that. I don't know the specifics on those.
But they're not, you haven't identified particular places they're coming from. These are just people who have returned.
Correct.
After a while away and were immediately.
Yeah, there's been no sort of cluster effect from anything that, if we get to a cluster, we'll talk about it specifically.
You said there's one case affiliated with a group home. Are you concerned about the spread? I know we've talked a lot about facility-driven cases.
Yeah, so we with that facility, we've done testing. So our answer now is when we get a business or any facility spread, we did an executive order telling the entities they have to hand over their roster, their employee roster, and our response is we want to offer testing to anybody that works there, and that's how we're going to respond moving forward. Is we've built up a testing capacity. We need to use it not just when we know where COVID is, but also we want to use this testing capacity in a proactive way to open up different segments of our economy as well. And so if you think about just gatherings, right, you're going to have gatherings where we want to be able to allow more people together in different ways. Right now, with our infection rate in our community, we know if there's 1,000 people, at least one has COVID there. That's just the math. Now, if you have 1,000 people and you use your testing to invite 1,000 people in the doors and everybody tests negative, you know that nobody has COVID, right? So part of how you open up your economy moving forward in different of these high-risk hospitality areas is you utilize testing. We've been talking to the state about that as well.
I'm a little behind on this. What's our infection rate?
Yeah, basically anywhere between 0.75 to 1.25 has been where we've been in Onondaga County. Yeah.
So 1 out of 100?
Yes. Yeah, 1 out of 100, then 10 out of 1,000, yes.
Okay.
Ryan, I'm going to ask the same thing you were asked. Easter weekend, Memorial Day weekend. As we go into 4th of July, what are your biggest concerns?
I'm concerned that because our numbers have gone in the right direction and the weather's nice, we're back to work, not all of us, but a lot of us, that people are losing focus a little, or we don't need to lose focus at this point, that it just takes one mistake to really cause a cluster. And then that cluster is worth a lot of people in quarantine and a lot of people who get sick. So once you get your arms around that cluster, you move aside, and it takes one more mistake to create another one. So a cluster is really a week to 10 days worth of positive cases. And so we've built up infrastructure to deal with that. Early on, that would become a real problem for us. Now it's not a real problem for us, but it's a problem for those who sit there. And if we don't respect this virus and we have multiple clusters, that's when your reopening of your economy comes to a halt. And then if you really don't respect it, that's when things can go backwards. So we owe it to all of the businesses on the sidelines still that have not been able to reopen to respect this virus and to wear a mask. It's exhausting dealing with the complaints and working on folks that just don't want to wear a mask still. It's not everybody. It's a very small minority. But the science is very clear on this now, that it helps. And certainly physically distance. Why? Because we know it works. That's what works. So I think going into the weekend, I'm not concerned about people going out to eat. I'm not concerned about people going to the stores. Businesses regulate the mask wearing for the most part. I am concerned about people getting together with more than 50 people. And if you have plans to do that, it's a bad idea. I want to continue to progress so we can open up our economy so everybody gets their liberties back and you can do things that you wanted to do before COVID. But we can't go backwards. Yeah, I think what the protocol is, they're going to warn groups to disperse, and then certainly if folks are not listening at this point, I'm asking our local law enforcement partners, they need to act. There's only so many warnings. We know larger gatherings will cause new cases. I'm telling the public that's what happened. We have the data, so we need everybody to in our law enforcement community to go through and be safe with your own personnel, but we can't allow these things to happen. It's not okay, and it leads to more risk with spreading this virus and extending this pandemic when we have this type of behavior.
Ryan, one question we get is, how come people can't have more than 50 people, let's say, at a wedding or a large gathering, but there can be protests of more than 50 people, sometimes hundreds? What is the difference, to explain to somebody that may be watching now?
It's very difficult to make that argument, right? So I understand it. I don't like it that this is where we are. I think the technical response would be people have a right to free speech. They have a right to there was a court case about churches and outdoor services that suggested, the federal court suggested that you have to treat religious institutions the same way as you do protests. But that's one of the issues now. That's the technical answer. From the standpoint of having people together in a pandemic, that's the legal answer, right? The pandemic answer is there is no difference, really. And the large gatherings, no matter what they are not good during a pandemic. And we need to mitigate the risk. I want weddings to be done. And I think weddings, for example, are a unique situation. And we've asked in our control rooms to give out guidance. Think about it. this is all about when we have gatherings. The challenge is how do you stop the spread, and you box it in and you deal with that cluster if it happens, or you block a cluster from happening. On a wedding, you're inviting everybody, right? Very few wedding crashers. All right, so very few wedding crashers to weddings. You're inviting everybody. You know who they are. In the event someone gets sick, you can quickly contact trace and work on that. So it's tough when I hear from brides and grooms or moms and dads about, look at what's happening here. I don't got a good response for them. But we're working to do this, and we're working to say to the state on some of these larger weddings, you have a list for contact tracing. Everybody's there. Use testing. Use it. Figure out ways to have regulations to have these events, and then if people choose not to do that, then that's their choice, right? And so that's a long-winded answer to your question, but I think we covered a lot of material there. Other questions? No? Okay, good. Good to see Tim Knaus back. Tim, good to see you, my friend. Some good news. I know everybody was watching as we unveiled at the Great Rosamond Gifford Zoo our baby snow leopard last week. I think it was last week. And we put a naming contest out. We have an I Love New York theme, so the themes are names of different communities in New York State. I am happy to report that County Executive Tony Picenti in Oneida County and all his constituents worked very hard. They got their votes in, the votes were counted, and our new baby snow leopard's name is Marcy. And so Marcy in Oneida County, Marcy the snow leopard, so please, we expect the baby snow leopard to be available to the public to see the next 4 or 5 weeks here as our little cub gets stronger. But again, I want to thank the community for the work we've done. This is all because of the work we've done collectively. A lot of progress. We just can't go backwards. We got to go forwards. Other parts of the country are struggling. We haven't. We know what works. We need to double down on what works now. No unforced errors in this process. And we'll continue to see great progress. And we'll get our economy back before they do. And we'll get our lives back before they do. But we really need you to buy in and continue this fight with us. So please have a happy 4th of July. Enjoy the weather. It's going to be hot. Be safe. And we'll see you next week.